Question 1. The monitoring system demonstrates that an older adult client who lives alone and has a history of falls has recently expressed a strong desire to remain independent in their home. During a home safety assessment, the occupational therapist identified several environmental hazards, including a lack of grab bars in the bathroom, poor lighting in hallways, and a high threshold at the front door. The client has voiced resistance to installing grab bars, stating they are ugly and will make the bathroom feel like a hospital. The therapist also noted that the client's balance has slightly declined since the last assessment, though they are still able to ambulate independently with a cane. Which of the following approaches best reflects professional practice in addressing this situation? Option A. Prioritize the client's expressed aesthetic concerns and focus on less intrusive modifications, such as improving lighting and addressing the door threshold, while deferring the grab bar discussion until the client is more receptive. Option B. Recommend that the client consider moving to an assisted living facility due to the identified safety risks and the client's resistance to necessary modifications, thereby reducing the therapist's liability. Option C. Explain to the client that safety is paramount and that grab bars are a necessary modification to prevent future falls, proceeding with installation despite their reservations to ensure their well-being. Option D. Collaborate with the client to explore various aesthetically pleasing grab bar options and discuss the functional benefits and safety rationale in detail, while also addressing other identified hazards and empowering the client to make an informed decision about the bathroom modifications. The correct answer is A. Prioritize the client's expressed aesthetic concerns and focus on less intrusive modifications, such as improving lighting and addressing the door threshold, while deferring the grab bar discussion until the client is more receptive. Explanation. This scenario presents a common challenge in occupational therapy practice, balancing client autonomy with safety concerns, particularly when working with older adults who may have declining cognitive or physical capacities. The professional must navigate the client's expressed wishes against objective safety risks identified through assessment, all while adhering to ethical principles and regulatory guidelines. The complexity arises from the need to provide recommendations that are both effective in promoting independence and safe, without being overly restrictive or paternalistic. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered process. It involves a thorough assessment of the home environment and the client's functional abilities, followed by a discussion of findings and potential solutions with the client and their family. This approach respects the client's right to self-determination while ensuring they are informed about risks and benefits. It aligns with NBCOT Code of Conduct, which emphasizes providing competent services, respecting client rights, and advocating for clients' needs. Specifically, it upholds the principle of informed consent by ensuring the client understands the rationale behind recommendations and has the opportunity to participate in decision-making. An incorrect approach that focuses solely on implementing modifications without client involvement fails to respect client autonomy and the right to self-determination, potentially leading to non-compliance and resentment. This violates ethical principles of client-centered care and may contravene NBCOT guidelines regarding client participation in goal setting and intervention planning. Another incorrect approach that dismisses the client's concerns or preferences, even if based on perceived safety risks, demonstrates a lack of respect for the individual and can undermine the therapeutic relationship. This could be seen as a failure to provide services in a manner that respects the client's values and beliefs, a core tenet of ethical practice. Furthermore, an approach that relies on assumptions about the client's capabilities without objective assessment and clear communication risks misinterpreting the situation and providing inappropriate recommendations, potentially leading to ineffective interventions or unnecessary limitations on the client's independence. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a comprehensive occupational therapy evaluation, including environmental assessment and functional performance. 2. Identify potential risks and barriers to safety and independence. 3. Discuss findings and potential interventions collaboratively with the client and relevant stakeholders, explaining the rationale and potential outcomes of each option. 4. Empower the client to make informed decisions about their care, respecting their values and preferences. 5. Document the assessment, recommendations, client's decisions, and rationale for all interventions. 6. Reevaluate and adjust interventions, as needed based on client progress and changing circumstances. Question 2. Benchmark analysis indicates that an occupational therapist is working with a client who expresses a strong desire to regain independence in preparing meals at home following a recent stroke. The client emphasizes their frustration with relying on others for this daily activity. When considering which model of practice to primarily guide the assessment and intervention, which of the following approaches best reflects a comprehensive understanding of occupational performance as defined by NBCOT OTR standards? Option A. Focusing exclusively on the client's stated goal of meal preparation independence, implementing a task-specific training program to improve motor skills required for cooking. Option B. Prioritizing a biomechanical approach to address any identified physical deficits in upper extremity function that may be impacting the ability to chop vegetables or stir pots. Option C. Adopting the Canadian model of occupational performance (CertMedbry) to explore the client's personal values, spirituality, and the environmental factors influencing their meal preparation, alongside the task itself. Option D. Utilizing a cognitive behavioral model to address any perceived barriers to independence, such as anxiety about making mistakes while cooking. The correct answer is C. Adopting the Canadian model of occupational performance (CertMedbry) to explore the client's personal values, spirituality, and the environmental factors influencing their meal preparation, alongside the task itself. Explanation. This scenario presents a professional challenge because the occupational therapist must select a model of practice that not only aligns with the client's stated goals, but also comprehensively addresses the multifaceted nature of occupational performance as defined by NBCOT OTR standards. The client's focus on a single aspect of their life, while valid, may not encompass all relevant environmental and personal factors that influence their ability to engage in meaningful occupations. Careful judgment is required to ensure the chosen model facilitates a holistic assessment and intervention plan that is client-centered and evidence-based, adhering to the NBCOT OTR's emphasis on the interplay between person, environment, and occupation. The correct approach, utilizing the Canadian model of occupational performance (CertMedbry), represents best professional practice because it explicitly emphasizes the person's spirituality, a core component of the CertMedbry that influences motivation and meaning in occupations. It also inherently considers the environment and occupation as distinct but interacting elements, providing a framework for a comprehensive assessment and intervention. This aligns with NBCOT OTR's mandate to promote occupational participation and well-being by addressing the client's intrinsic values and the contextual factors influencing their occupational engagement. The CertMedbry's focus on client-centeredness and empowerment is a cornerstone of ethical occupational therapy practice, an approach that solely focuses on the client's stated desire for increased independence in a specific task, without considering the broader environmental influences or personal factors beyond the immediate task, fails to meet the comprehensive assessment requirements mandated by NBCOT OTR. This narrow focus risks overlooking crucial barriers or facilitators to occupational engagement, potentially leading to ineffective interventions. Ethically, it may also fail to fully respect the client's right to self-determination by not exploring all avenues for enhancing their occupational performance. An approach that prioritizes a purely biomechanical intervention without integrating the client's personal values or environmental context neglects the holistic nature of occupational therapy as promoted by NBCOT OTR. This can lead to interventions that improve physical function in isolation, but do not translate to meaningful participation in life roles. Ethically, it may not adequately address the client's overall well-being or their subjective experience of occupational performance. An approach that adopts a purely cognitive behavioral framework without acknowledging the influence of the physical environment or the client's spiritual well-being, as central to models like the CertMedbry, is insufficient. NBCOT OTR standards require consideration of the interconnectedness of all factors influencing occupation. Failing to do so can result in interventions that are not fully responsive to the client's unique needs and values. The professional reasoning process for similar situations should begin with a thorough understanding of the client's stated goals and concerns. This should then be followed by an exploration of the client's values, beliefs, and spirituality, as well as an assessment of the environmental contexts, physical, social, cultural that support or hinder their occupational engagement. Selecting a model of practice that provides a comprehensive framework for integrating these elements, such as the CMAPE, will guide the assessment and intervention planning process, ensuring a client-centered and holistic approach that aligns with NBCOT OTR standards. Question 3. Research into a client's desire to return to driving after a stroke reveals they express a strong wish to resume this activity independently. However, initial observations and screening suggest potential deficits in visual scanning, reaction time, and judgment that may impact their ability to operate a vehicle safely. The occupational therapist must determine the most appropriate next step in the assessment process. Option A. Proceed with interventions aimed at improving the client's general motor skills without directly addressing the specific demands of driving, assuming improvements will naturally translate to driving safety. Option B. Conduct a comprehensive driving evaluation, including on-road testing, to objectively assess the client's actual driving performance and safety in a real-world context, while also exploring adaptive strategies or alternative transportation options if necessary. Option C. Immediately inform the client that they are not safe to drive and focus intervention solely on alternative transportation methods, as their expressed desire is secondary to safety concerns. Option D. Accept the client's stated desire to drive as the primary goal and proceed with a simplified assessment that confirms their ability to operate a vehicle, prioritizing their autonomy over potential safety risks. The correct answer is B. Conduct a comprehensive driving evaluation, including on-road testing, to objectively assess the client's actual driving performance and safety in a real-world context, while also exploring adaptive strategies or alternative transportation options if necessary. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's stated desire and their demonstrated capacity for safe occupational performance, particularly in a context where the occupational therapist's primary responsibility is to promote well-being and prevent harm. The therapist must navigate the ethical principles of autonomy and beneficence, balancing the client's right to self-determination with the professional obligation to ensure safety and prevent potential injury. This requires careful assessment, clear communication, and a collaborative approach to goal setting. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered evaluation of occupational performance. This involves not only understanding the client's goals, but also objectively assessing their underlying skills, deficits, and environmental factors that impact their ability to engage in the desired occupation safely and effectively. By employing evidence-based assessment tools and engaging in shared decision-making, the therapist upholds the NBCOT practice standards and code of ethics, which mandate competent practice, client welfare, and informed consent. This approach fosters a therapeutic alliance built on trust and transparency, leading to more realistic and achievable goals that promote independence and minimize risk. An incorrect approach that focuses solely on fulfilling the client's stated desire without adequate assessment of their capabilities would violate the NBCOT practice standards regarding competent service delivery and client safety. It would also contravene the ethical principle of non-maleficence, as it could lead to an unsafe situation and potential harm to the client. Another incorrect approach that dismisses the client's goals outright without exploring underlying reasons or offering alternatives would disrespect the client's autonomy and could damage the therapeutic relationship, potentially leading to non-adherence and disengagement from services. This fails to meet the ethical obligation to respect the client's dignity and right to self-determination. The professional decision-making process in such situations involves a systematic approach. 1. Gather comprehensive information through client interviews, observation, and standardized assessment to understand the client's goals, values, and occupational performance deficits. 2. Analyze the findings to identify barriers and facilitators to achieving the desired occupation safely. 3. Collaborate with the client to discuss assessment results, explore potential risks and benefits of different approaches, and jointly set realistic and meaningful goals. 4. Develop an intervention plan that addresses identified deficits and promotes safe engagement in occupations. 5. Continuously monitor progress and reevaluate goals and interventions as needed, maintaining open communication with the client. Question 4. The evaluation methodology shows an understanding of the historical evolution of occupational therapy, specifically recognizing how early approaches influence the profession's foundational principles, which historical perspective, when integrated into current practice, best reflects the client-centered and participation-focused ethos mandated by NBCOT OTR standards. Option A. The post-World War Roman II medical model's emphasis on rehabilitation as a means to return individuals to pre-illness functional levels, often with a deficit-based approach. Option B. The moral treatment movement's emphasis on purposeful activity and engagement in meaningful occupations as a means of restoring mental and physical well-being. Option C. The purely biomedical models focus on diagnosing and treating specific physical impairments with little consideration for the individual's social or environmental context. Option D. The early 20th century focus on vocational rehabilitation and the use of crafts primarily as a means to develop fine motor skills for industrial work. The correct answer is B. The moral treatment movement's emphasis on purposeful activity and engagement in meaningful occupations as a means of restoring mental and physical well-being. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an occupational therapist to critically examine the historical underpinnings of their practice and how those historical perspectives might influence current evaluation methodologies. The challenge lies in recognizing that past societal attitudes and medical models, while influential in shaping the profession, may not align with contemporary evidence-based practice and the client-centered principles mandated by NBCOT OTR regulations. A careful judgment is required to discern which historical influences are foundational and still relevant versus those that are outdated or potentially detrimental to ethical and effective practice. Correct approach analysis. The correct approach represents best professional practice because it acknowledges the historical evolution of occupational therapy, specifically the shift from a medical model focused on disease to a client-centered model emphasizing participation and well-being. This aligns with NBCOT OTR standards that prioritize client autonomy, evidence-based interventions, and a holistic understanding of the individual within their environment. Recognizing the historical context of the moral treatment movement and its influence on early occupational therapy practices, which emphasized purposeful activity and engagement, directly supports a client-centered evaluation that seeks to understand the individual's roles, habits, and environmental contexts, rather than solely focusing on deficits. This approach is ethically sound and compliant with NBCOT OTR guidelines by ensuring evaluations are comprehensive, respectful, and tailored to individual needs and goals. Incorrect approaches analysis. One incorrect approach fails to acknowledge the significant shift from early, often medically driven, approaches to the current client-centered paradigm, focusing solely on the historical medical model's emphasis on curing or fixing deficits without integrating the principles of enablement and participation would be a regulatory and ethical failure. This overlooks the NBCOT OTR's emphasis on client empowerment and the promotion of meaningful engagement in life roles. Another incorrect approach might overemphasize the purely craft-based or vocational aspects of early occupational therapy, neglecting the broader psychosocial and environmental factors that are now integral to the profession. This would be a failure to adhere to the comprehensive scope of practice outlined by NBCOT OTR, which requires consideration of all aspects of a client's life that influence their occupational performance. A third incorrect approach could dismiss historical influences entirely, viewing them as irrelevant to modern practice. This would be a failure to understand the foundational principles that have shaped occupational therapy and could lead to a superficial understanding of current practices, potentially missing valuable insights into the profession's development and its core values as recognized by NBCOT OTR. Professional reasoning. Professionals should employ a decision-making framework that involves critically evaluating the historical context of occupational therapy in relation to current NBCOT OTR standards and ethical guidelines. This includes understanding the evolution of practice models, recognizing the influence of societal changes on the profession, and consistently applying client-centered principles. When evaluating historical influences, professionals should ask, how does this historical perspective inform our understanding of occupation and its therapeutic use today, and does it align with current ethical and regulatory requirements for client-centered care? This critical self-reflection ensures that practice remains grounded in evidence, ethical principles, and the evolving needs of clients. Question 5. Market research demonstrates a growing interest in holistic wellness coaching services that aim to improve overall life satisfaction and stress reduction. An occupational therapist is considering offering such a service to their existing client base, in addition to their standard occupational therapy interventions. Which of the following best aligns with the definition and scope of occupational therapy as regulated by the NBCOT OTR? Option A. Providing nutritional counseling and meal planning services to clients as a means to improve their overall health and energy levels for daily tasks. Option B. Developing and implementing individualized intervention plans that address a client's ability to engage in meaningful daily life activities, promoting health, well-being, and participation in life roles, while also educating clients on stress management techniques as they relate to occupational performance. Option C. Offering general life coaching sessions focused on goal setting and motivation for personal growth, irrespective of specific occupational performance deficits or participation in daily life activities. Option D. Facilitating group meditation and mindfulness sessions for the general public, with the primary goal of promoting relaxation and stress reduction, without direct assessment of individual occupational needs. The correct answer is B. Developing and implementing individualized intervention plans that address a client's ability to engage in meaningful daily life activities, promoting health, well-being, and participation in life roles, while also educating clients on stress management techniques as they relate to occupational performance. Explanation. This scenario presents a professional challenge because it requires the occupational therapist to navigate the evolving landscape of service delivery while adhering strictly to the NBCOT OTR regulatory framework, which defines the scope of practice. The therapist must discern between services that fall within the established definition and scope of occupational therapy and those that might be perceived as beneficial, but are outside of this defined scope, potentially leading to ethical and regulatory breaches. Careful judgment is required to ensure client safety, efficacy of intervention, and professional integrity. The correct approach represents best professional practice because it aligns directly with the NBCOT OTR's definition and scope of occupational therapy. This involves providing interventions that are client-centered, occupation-based, and aimed at promoting health and participation in life. By focusing on activities that are meaningful to the client and addressing their ability to perform these activities, the therapist is operating within the established professional boundaries and ethical guidelines. This ensures that services are evidence-based and contribute to the client's occupational performance and well-being as defined by the profession. An incorrect approach that involves providing services solely based on a perceived market demand or a general desire for wellness, without a clear occupational therapy rationale, fails to adhere to the NBCOT OTR's scope of practice. This could lead to practicing outside of one's competency or providing services that are not evidence-based within the profession, potentially violating ethical principles of beneficence and non-maleficence. Another incorrect approach might involve delegating tasks that require the clinical reasoning and expertise of an occupational therapist to unlicensed personnel without proper supervision, which is a direct violation of regulatory standards and ethical practice. A third incorrect approach could be to offer services that are clearly within the domain of other healthcare professions, without appropriate collaboration or referral, thereby overstepping professional boundaries and potentially compromising client care. Professionals should employ a decision-making framework that begins with a thorough understanding of the NBCOT OTR's definition and scope of occupational therapy. When faced with a new service idea or client request, the therapist should ask, does this intervention directly address the client's occupational performance deficits or promote their participation in meaningful occupations? Is this intervention supported by occupational therapy theory and evidence? Am I acting within my scope of practice and competency? Does this align with the ethical principles of the profession? If the answer to any of these questions is unclear or negative, the therapist should seek consultation with peers, supervisors, or relevant professional organizations to ensure adherence to regulatory and ethical standards. Question 6. Which approach would be most appropriate for an occupational therapist to utilize when addressing a client's progressive joint stiffness and limited range of motion in their hand, impacting their ability to perform daily self-care tasks? Option A. Recommend a prefabricated static splint to maintain the current joint position and prevent further stiffness. Option B. Fabricate and fit a custom dynamic splint to facilitate graded active and passive range of motion exercises. Option C. Suggest the client explore over-the-counter assistive devices for dressing and grooming without addressing the underlying joint limitations. Option D. Advise the client to focus solely on home exercise programs without any splinting intervention. The correct answer is B. Fabricate and fit a custom dynamic splint to facilitate graded active and passive range of motion exercises. Explanation. This scenario presents a common challenge in occupational therapy, selecting the most appropriate therapeutic modality for a client with complex needs. The professional must balance the client's immediate functional goals with long-term outcomes, considering the principles of evidence-based practice and client-centered care within the NBCOT OTR regulatory framework. The challenge lies in discerning which modality offers the greatest potential for meaningful participation and independence, while adhering to ethical standards and scope of practice. The correct approach prioritizes a comprehensive assessment to inform the selection of a dynamic splint. This aligns with NBCOT OTR standards that emphasize client evaluation as the foundation for intervention. A dynamic splint, when appropriate, allows for graded movement and can address specific biomechanical limitations, promoting functional gains and preventing further contracture. This approach is best professional practice because it is data-driven, client-centered, and directly addresses the underlying impairments contributing to functional limitations, thereby maximizing the potential for improved occupational performance. An incorrect approach would be to immediately prescribe a static splint without a thorough assessment. This fails to consider the client's potential for active movement and may inadvertently restrict functional gains, potentially violating the ethical principle of beneficence by not providing the most effective intervention. Another incorrect approach would be to rely solely on the client's preference for a particular modality without clinical justification. While client preference is important, it must be balanced with the therapist's professional judgment and evidence-based practice, as mandated by NBCOT OTR guidelines, to ensure safety and efficacy. Prescribing a modality without considering the client's current functional status and potential for change also represents a failure to adhere to the core tenets of occupational therapy assessment and intervention. Professionals should employ a decision-making process that begins with a thorough client evaluation, including occupational profile and performance deficits. This is followed by identifying potential interventions, considering their evidence base, client goals, and the therapist's expertise. The chosen intervention should then be implemented, monitored, and re-evaluated for effectiveness, with adjustments made as needed. This iterative process ensures that interventions are tailored to the individual client and are aligned with professional standards and ethical obligations. Question 7. The review process indicates that a client who is experiencing significant anxiety and has a history of negative experiences with healthcare providers has expressed strong skepticism about the occupational therapist's intentions and the perceived usefulness of therapy. The client states, "I don't see how you can help me. I've tried things before and they never worked. I'm not sure you're really on my side." The therapist needs to address this resistance to effectively build rapport and facilitate engagement in therapeutic activities. Which of the following actions best demonstrates an understanding of therapeutic relationship building in this context? Option A. Suggest that the client might benefit from a different therapist who is a better fit for their needs, as the current therapeutic relationship appears to be compromised. Option B. Acknowledge the client's feelings and express a desire to understand their past experiences and concerns, offering to collaboratively explore how therapy might be tailored to their specific needs and goals. Option C. Gently but firmly explain that the therapist's role is to provide evidence-based intervention and that the client's skepticism is hindering their progress, encouraging them to trust the process. Option D. Reassure the client that the therapist is highly qualified and has a proven track record of success. Then proceed with the planned intervention to demonstrate the therapy's effectiveness. The correct answer is B. Acknowledge the client's feelings and express a desire to understand their past experiences and concerns, offering to collaboratively explore how therapy might be tailored to their specific needs and goals. Explanation. This scenario presents a common professional challenge in occupational therapy, navigating a client's resistance and potential mistrust while striving to establish a therapeutic alliance. The clients express skepticism about the therapist's intentions and the value of therapy, coupled with their reluctance to engage, directly impacts the ability to implement interventions effectively. Building rapport is foundational to occupational therapy practice, as it fosters trust, encourages participation, and ultimately leads to better outcomes. NBCOT OTR regulations emphasize the importance of client-centered care, which inherently requires a strong therapeutic relationship. The correct approach prioritizes understanding the client's perspective and validating their feelings before attempting to re-engage them in the therapeutic process. This involves active listening, empathy, and a non-judgmental stance. By acknowledging the client's concerns and exploring the root of their skepticism, the therapist demonstrates respect for their autonomy and experiences. This aligns with NBCOT OTR ethical standards that mandate treating clients with dignity and respect, and promoting their self-determination. This approach fosters trust, which is essential for effective collaboration and goal attainment. An incorrect approach that dismisses the client's feelings or attempts to force engagement would violate ethical principles. For instance, proceeding with interventions without addressing the client's expressed resistance could be seen as disregarding their autonomy and potentially creating a coercive environment, which is contrary to client-centered practice. Another incorrect approach might involve the therapist becoming defensive or overly focused on justifying their own actions, rather than seeking to understand the client's viewpoint. This can further erode trust and damage the therapeutic relationship, hindering progress. A failure to address the client's concerns directly and empathetically represents a lapse in professional judgment and a deviation from the ethical imperative to establish a collaborative partnership. The professional decision-making process in such situations should involve a systematic approach. First, actively listen to and acknowledge the client's concerns without interruption or immediate judgment. Second, explore the underlying reasons for their skepticism through open-ended questions and empathetic responses. Third, collaboratively problem-solve, involving the client in identifying strategies to build trust and address their reservations. Finally, document the client's concerns and the interventions taken to address them, ensuring transparency and accountability. Question 8. The analysis reveals that a client with a recent stroke expresses a strong desire to focus solely on practicing playing a musical instrument as their primary occupational therapy intervention to regain fine motor skills in their affected hand. The occupational therapist has identified that while this activity engages the client, it may not comprehensively address all the underlying deficits contributing to their functional limitations in activities of daily living. What is the most appropriate approach for the occupational therapist to develop the intervention plan? Option A. Immediately implement the client's preferred activity of playing a musical instrument as the sole intervention, as client preference is the highest priority. Option B. Focus exclusively on the therapist's assessment findings and implement interventions deemed most effective by the therapist, regardless of the client's stated preferences. Option C. Collaboratively explore alternative or supplementary interventions that target the specific underlying motor control deficits identified in the assessment, while still incorporating the client's preferred activity of playing a musical instrument as a component of the plan. Option D. Advise the client that playing a musical instrument is not a sufficiently evidence-based intervention for stroke recovery, and suggest a different, therapist-selected set of exercises. The correct answer is C. Collaboratively explore alternative or supplementary interventions that target the specific underlying motor control deficits identified in the assessment, while still incorporating the client's preferred activity of playing a musical instrument as a component of the plan. Explanation. This scenario presents a professional challenge because the occupational therapist must balance the client's stated preferences with the therapist's professional judgment regarding the most effective and safe intervention strategies, all within the NBCOT OTR regulatory framework. The therapist must ensure that the intervention plan is client-centered, evidence-based, and adheres to ethical principles of beneficence and non-maleficence. The correct approach represents best professional practice because it prioritizes a collaborative decision-making process that integrates the client's goals and preferences with the therapist's expertise and knowledge of evidence-based interventions. This aligns with the NBCOT OTR Code of Conduct, which emphasizes client autonomy and the therapist's responsibility to provide competent and ethical services. By exploring alternative interventions that address the client's underlying needs while respecting their preferences, the therapist upholds the principle of client-centered care and promotes engagement and adherence to the intervention plan. An incorrect approach that solely focuses on the client's initial, potentially less effective, request without further exploration fails to demonstrate professional competence and may not lead to optimal outcomes. This could be considered a failure to act in the client's best interest, violating the principle of beneficence. Another incorrect approach that dismisses the client's preferences outright without attempting to understand the rationale behind them or explore compromises could be seen as paternalistic and disrespectful of client autonomy, a core ethical principle. Furthermore, implementing an intervention without sufficient evidence to support its efficacy for the client's specific needs would violate the NBCOT OTR standard for providing evidence-based practice. The professional reasoning process should involve a thorough assessment review, active listening to the client's stated goals and preferences, and a discussion of potential intervention options, including their rationale, expected outcomes, and potential risks. The therapist should then collaboratively develop an intervention plan that is mutually agreed upon, ensuring it is tailored to the client's unique needs and aligns with professional standards and ethical guidelines. Question 9. Strategic planning requires an occupational therapist to develop an intervention plan for a client who expresses strong cultural beliefs about modesty and physical touch, which may impact their willingness to participate in certain hands-on therapeutic activities. The therapist has identified several evidence-based interventions that could be beneficial. How should the therapist proceed to ensure culturally competent and sensitive care? Option A. Inform the client that their cultural beliefs are not compatible with the recommended treatment and suggest they seek services elsewhere if they cannot comply. Option B. Engage in an open dialogue with the client to understand their specific cultural beliefs and concerns regarding modesty and touch, and collaboratively explore modifications to the proposed interventions that respect these beliefs while still addressing their occupational goals. Option C. Proceed with the interventions, making minor adjustments without explicitly discussing the cultural concerns with the client to avoid making them uncomfortable. Option D. Implement the evidence-based interventions as planned, assuming that the client will adapt to the therapeutic process once they experience the benefits. The correct answer is B. Engage in an open dialogue with the client to understand their specific cultural beliefs and concerns regarding modesty and touch, and collaboratively explore modifications to the proposed interventions that respect these beliefs while still addressing their occupational goals. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the occupational therapist to navigate a complex situation involving a client's deeply held cultural beliefs that may conflict with standard therapeutic interventions. The therapist must balance the client's autonomy and cultural identity with the need to provide effective and safe occupational therapy services. Failure to do so could lead to a breakdown in the therapeutic relationship, client non-adherence, and potentially suboptimal outcomes. Correct approach analysis. The correct approach demonstrates cultural competence and sensitivity by prioritizing open communication, active listening, and collaborative problem solving. It acknowledges the client's cultural context as a primary factor in understanding their needs and preferences. This aligns with NBCOT emphasis on ethical practice, client-centered care, and the provision of services that are respectful of diversity. Specifically, it upholds the principle of respecting client autonomy and self-determination, as well as the ethical obligation to provide services that are tailored to the individual's unique circumstances, including their cultural background. Incorrect approaches analysis. One incorrect approach fails by assuming a universal approach to care, disregarding the client's cultural background. This violates the ethical principle of providing individualized care and demonstrates a lack of cultural competence, potentially leading to misinterpretations of the client's needs and preferences. It could also be seen as paternalistic, imposing the therapist's own cultural norms onto the client. Another incorrect approach errs by dismissing the client's cultural beliefs as irrelevant or a barrier to treatment. This is ethically unsound as it devalues the client's identity and lived experience, undermining the therapeutic alliance. It also fails to recognize that cultural beliefs can significantly impact a client's engagement in and perception of therapy, thus hindering effective intervention. A third incorrect approach is to proceed with the intervention without fully understanding or addressing the client's concerns. This demonstrates a lack of due diligence and respect for the client's cultural perspective. It prioritizes the therapist's agenda over the client's well-being and autonomy, potentially leading to a negative therapeutic experience and poor outcomes. Professional reasoning. Professionals should employ a decision-making process that begins with active listening and empathic inquiry to understand the client's perspective, including their cultural beliefs and values. This should be followed by a collaborative discussion to explore potential adaptations to interventions that respect these beliefs while still achieving therapeutic goals. If significant conflicts arise, professionals should consult with supervisors, colleagues, or cultural liaisons and refer to relevant ethical guidelines and practice standards, such as those outlined by NBCOT, to ensure client-centered and culturally sensitive care. Question 10. The control framework reveals that an occupational therapist is working with a new client who has experienced a stroke and is expressing a desire to return to gardening. The therapist's initial assessment indicates significant limitations in fine motor coordination and upper extremity strength, which would likely impact the client's ability to perform many gardening tasks independently. When developing the intervention plan, which approach best embodies the principles of client-centered care as defined by NBCOT OTR guidelines. Option A. Collaborate with the client to identify specific gardening activities they wish to resume, explore adaptive tools and techniques that can support these activities, and incorporate strategies to improve relevant functional skills in a way that is meaningful to the client's stated goal. Option B. Develop an intervention plan that prioritizes improving fine motor coordination and upper extremity strength to a level the therapist deems sufficient for independent gardening, without extensively discussing alternative gardening methods or the client's specific gardening interests. Option C. Focus the intervention plan on improving overall functional mobility and balance, as these are critical for safety, and defer discussions about specific leisure pursuits like gardening until these foundational skills are addressed. Option D. Base the intervention plan primarily on the recommendations of the client's spouse, who expresses concern about the client's safety and ability to manage the physical demands of gardening. The correct answer is B. Develop an intervention plan that prioritizes improving fine motor coordination and upper extremity strength to a level the therapist deems sufficient for independent gardening, without extensively discussing alternative gardening methods or the client's specific gardening interests. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the occupational therapist's expertise with the client's autonomy and preferences. The therapist must navigate potential discrepancies between what is deemed clinically beneficial and what the client desires, ensuring that the therapeutic relationship remains collaborative and respectful. This requires careful judgment to avoid imposing personal biases or professional assumptions onto the client's goals and values. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the core principles of client-centered care, as mandated by NBCOT OTR regulatory frameworks. This approach prioritizes the client's stated goals, values, and preferences in the development of the intervention plan. It acknowledges that the client is the expert on their own life and experiences, and that occupational therapy interventions are most effective when they are meaningful and relevant to the individual. This is ethically sound and aligns with the NBCOT practice standards, which emphasize client participation and self-determination. Incorrect approach is analysis. An approach that focuses solely on the therapist's assessment of functional deficits without actively soliciting and integrating the client's priorities fails to uphold the principle of client-centered care. This can lead to interventions that are not meaningful to the client, potentially reducing engagement and adherence, and may be seen as a failure to respect client autonomy as outlined in ethical guidelines. An approach that prioritizes achieving specific clinical outcomes as defined by the therapist, even if they differ from the client's stated desires, risks paternalism. This disregards the client's right to self-determination and can undermine the therapeutic alliance. It may also violate NBCOT standards that require interventions to be tailored to individual needs and goals. An approach that assumes the client's family members or caregivers have a better understanding of the client's needs than the client themselves, and bases the intervention plan primarily on their input, can be problematic. While family input is valuable, the client's voice must remain central. This can lead to interventions that do not align with the client's personal values or preferences, potentially infringing on their autonomy. Professional reasoning. Professionals should employ a decision-making process that begins with active listening and open-ended questioning to understand the client's perspective, goals, and values. This should be followed by a collaborative discussion where the therapist shares their clinical expertise and potential intervention strategies, but always in the context of how these align with the client's stated priorities. The intervention plan should be a shared creation, with ongoing opportunities for the client to provide feedback and adjust goals as needed. This iterative process ensures that the therapy remains client-centered and ethically grounded. Question 11. During the evaluation of a client with a recent stroke who expresses a strong desire to return to driving, the occupational therapist identifies significant deficits in visual scanning and reaction time that pose a safety risk. The client, however, is insistent on pursuing driving rehabilitation immediately, dismissing the therapist's concerns about their current abilities. What is the most ethically and professionally appropriate course of action for the occupational therapist? Option A. Inform the client that driving is not a safe option at this time and focus solely on other functional goals, without further discussion of driving-related concerns. Option B. Proceed with driving rehabilitation interventions as requested by the client, assuming their desire to drive outweighs the identified safety concerns. Option C. Collaborate with the client to explore their underlying motivations for driving, educate them on the specific visual and reaction time deficits identified, and discuss alternative strategies or adaptive approaches that could support their safety and independence, while also exploring potential driving rehabilitation pathways that address these specific deficits. Option D. Recommend that the client seek a second opinion from another occupational therapist regarding their driving abilities, without providing any further assessment or intervention. The correct answer is C. Collaborate with the client to explore their underlying motivations for driving, educate them on the specific visual and reaction time deficits identified, and discuss alternative strategies or adaptive approaches that could support their safety and independence, while also exploring potential driving rehabilitation pathways that address these specific deficits. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's stated preferences and the occupational therapist's professional judgment regarding safety and functional independence. The therapist must navigate the ethical principles of client autonomy and beneficence, ensuring the client's right to self-determination is respected, while also upholding the responsibility to provide safe and effective care. The NBCOT OTR exam emphasizes the importance of client-centered practice, which requires a collaborative approach to goal setting and intervention planning. The correct approach represents best professional practice because it prioritizes a thorough, client-centered evaluation that considers the client's values, interests, and goals in conjunction with objective assessment findings. This approach aligns with the NBCOT practice standards and code of conduct, which mandate that occupational therapists gather comprehensive information to inform their clinical reasoning and intervention planning. Specifically, it upholds the principle of informed consent by ensuring the client understands the rationale behind proposed interventions and has the opportunity to participate in decision-making. It also reflects the ethical obligation to provide services that are beneficial and minimize harm. An incorrect approach that disregards the client's stated preferences and unilaterally imposes interventions fails to respect client autonomy, a core ethical principle. This could be seen as paternalistic and may lead to decreased client engagement and adherence. Furthermore, it bypasses the crucial step of collaborative goal setting, which is fundamental to effective occupational therapy practice and is implicitly supported by NBCOT standards for client participation. Another incorrect approach that focuses solely on the therapist's perceived limitations without fully exploring the client's capacity or potential for adaptation overlooks the dynamic nature of occupational therapy interventions. It may prematurely limit the scope of practice and fail to explore creative solutions that could enable the client to achieve their desired outcomes. This approach may also violate the ethical principle of justice by not providing the client with the full range of services they might benefit from. A third incorrect approach that proceeds with interventions without adequately addressing the client's concerns or ensuring their understanding of the rationale behind the chosen course of action undermines the therapeutic relationship and the principles of informed consent. This can lead to a breakdown in trust and may result in interventions that are not aligned with the client's actual needs or desires, potentially leading to ineffective outcomes. The professional decision-making process in such situations involves a systematic approach. First, actively listen to and acknowledge the client's perspective and goals. Second, conduct a comprehensive evaluation, gathering both subjective and objective data. Third, synthesize this information to identify discrepancies or areas of concern. Fourth, engage in a collaborative discussion with the client, explaining the rationale for your professional recommendations, potential risks and benefits of different approaches, and exploring their willingness to try alternative strategies or adapt their goals. Finally, document the entire process, including the client's participation in decision-making and the rationale for the chosen course of action. Question 12. Risk assessment procedures indicate a potential safety hazard associated with a client's preferred method of performing a daily living activity. The client has clearly expressed their desire to continue using their preferred method, citing personal comfort and familiarity. How should the occupational therapist proceed to best assess and address the client's needs and preferences in this situation? Option A. Discuss the identified risks with the client. Explore alternative strategies that mitigate these risks while still respecting their preferences and collaboratively develop an intervention plan. Option B. Proceed with the client's preferred method, assuming the risk is acceptable because the client has expressed their preference. Option C. Implement an intervention that eliminates the identified risk, regardless of the client's stated preferences, to ensure their safety. Option D. Overrule the client's preferences and implement a safer method that the therapist deems appropriate, without further discussion. Correct answer is A. Discuss the identified risks with the client, explore alternative strategies that mitigate these risks while still respecting their preferences, and collaboratively develop an intervention plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the occupational therapist to balance the client's stated preferences with potential safety risks identified during a risk assessment. The therapist must navigate the client's autonomy and right to self-determination against their professional responsibility to ensure client safety and well-being, as mandated by NBCOT standards and ethical guidelines. This requires careful judgment to avoid paternalism while still upholding professional obligations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a collaborative process that respects the client's autonomy while integrating professional expertise. By discussing the identified risks with the client and exploring alternative strategies that align with their preferences and values, the therapist upholds the principles of client-centered care and informed consent. This approach is consistent with NBCOT emphasis on ethical practice, which includes respecting client rights and promoting participation in decision-making. It also aligns with the OT Code of Ethics principle of beneficence and non-maleficence by actively mitigating potential harm while maximizing benefit. Incorrect approaches analysis. One incorrect approach fails to adequately involve the client in the decision-making process, instead imposing a solution based solely on the risk assessment. This violates the ethical principle of autonomy and the client's right to self-determination, which are fundamental to occupational therapy practice and are implicitly supported by NBCOT focus on client engagement. This approach can lead to decreased client adherence and satisfaction. Another incorrect approach dismisses the client's preferences entirely, prioritizing the therapist's perception of safety over the client's lived experience and values. This is ethically problematic as it disregards the client as an active participant in their own care and can be seen as paternalistic. NBCOT standards emphasize understanding the client's context and goals, which includes their personal preferences and values. A further incorrect approach might involve proceeding with an intervention that carries significant, unmitigated risks, despite the client's stated preferences. This would be a failure to uphold the principle of non-maleficence, as the therapist has a professional obligation to identify and address potential harms. NBCOT framework expects practitioners to conduct thorough assessments and implement interventions that are safe and effective. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough assessment of the client's needs, preferences, and the environment. This includes a comprehensive risk assessment. Following the assessment, the therapist should engage in open and honest communication with the client, explaining the findings of the risk assessment and the potential implications. The next step involves a collaborative discussion to explore various intervention options, weighing the benefits and risks of each in relation to the client's goals and preferences. The therapist should then work with the client to develop a plan that maximizes safety while respecting their autonomy and promoting their engagement in meaningful occupations. This process ensures that interventions are client-centered, ethical, and aligned with professional standards. Question 13. Quality control measures reveal that a seasoned occupational therapist consistently utilizes a specific intervention technique for a particular client population, a technique that was considered best practice a decade ago. The therapist reports positive client outcomes with this method. However, recent peer-reviewed literature suggests newer, more evidence-based interventions may offer superior results or greater efficiency. What is the most appropriate course of action for the occupational therapist to ensure their practice remains aligned with current professional standards and evidence-based principles? Option A. Delegate the task of researching and implementing new evidence-based interventions to less experienced members of the therapy team to ensure the department stays current. Option B. Continue using the established intervention technique, as positive client outcomes indicate the current approach is effective and meets client needs. Option C. Actively seek out and critically appraise recent peer-reviewed literature and professional guidelines related to the intervention, and consider integrating new evidence into their practice if it demonstrates superior efficacy or efficiency. Option D. Rely on personal clinical experience and anecdotal evidence from colleagues who also use the same intervention, as this collective experience represents a valid form of evidence. The correct answer is C. Actively seek out and critically appraise recent peer-reviewed literature and professional guidelines related to the intervention, and consider integrating new evidence into their practice if it demonstrates superior efficacy or efficiency. Explanation. Scenario analysis. This scenario presents a common challenge in occupational therapy practice, where a therapist's established clinical habits may not align with current best practices derived from robust evidence. The professional challenge lies in balancing individual clinical experience with the imperative to provide the most effective and up-to-date interventions. This requires critical self-reflection and a commitment to ongoing learning, which are fundamental to maintaining professional competence and ethical practice. Correct approach analysis. The correct approach involves actively seeking and critically appraising current evidence to inform practice. This aligns directly with the NBCOT OTR exam's emphasis on evidence-based practice (EP), which is a cornerstone of ethical and competent occupational therapy. By reviewing recent peer-reviewed literature and consulting professional guidelines, the therapist demonstrates a commitment to providing interventions that are supported by the highest quality research, thereby maximizing client outcomes and adhering to professional standards of care. This proactive engagement with evidence ensures that practice is not based on outdated information or personal preference, but on what is demonstrably effective. Incorrect approaches analysis. One incorrect approach involves relying solely on personal clinical experience and anecdotal evidence. This fails to meet the EBP standard because personal experience, while valuable, is subjective and may not be generalizable or reflect the most effective intervention. It risks perpetuating outdated or less effective practices, potentially leading to suboptimal client outcomes and violating the ethical obligation to provide competent care as mandated by NBCOT standards. Another incorrect approach is to dismiss the need for updated evidence because current interventions appear to be yielding satisfactory results. This is problematic because satisfactory is not synonymous with optimal. Without consulting current evidence, the therapist may be unaware of more efficient, effective, or less resource-intensive interventions that could significantly improve client function and well-being. This stagnation in practice can be seen as a failure to uphold the professional responsibility to continually enhance one's knowledge and skills, which is implicitly required by NBCOT focus on professional development and quality care. A third incorrect approach is to delegate the responsibility of finding and implementing evidence-based interventions to junior staff without personal engagement. While supervision is important, the primary responsibility for ensuring that practice is evidence-based rests with the individual practitioner. This approach demonstrates a lack of personal accountability and a failure to actively engage in the critical appraisal and integration of evidence, which are essential components of professional practice and are expected by regulatory bodies like NBCOT. Professional reasoning. Professionals facing this situation should engage in a systematic process of self-assessment and evidence retrieval. This involves 1. Identifying the specific area of practice where current methods might be outdated. 2. Conducting a thorough literature search using reputable databases, e.g., PubMed, CINAHL for recent high-quality research, e.g., systematic reviews, randomized controlled trials related to the identified area. 3. Critically appraising the retrieved evidence for its validity, reliability, and applicability to the client population. 4. Integrating the evidence with clinical expertise and client values and preferences to inform intervention choices. 5. Documenting the rationale for intervention decisions, including the evidence consulted. This iterative process ensures that practice remains current, effective, and ethically sound. Question 14. Regulatory review indicates that occupational therapists must engage in effective goal setting with clients. A client expresses a desire to return to a highly demanding vocational activity that, based on the therapist's initial assessment, appears significantly beyond their current functional capacity and poses a substantial risk of re-injury. Which of the following approaches best aligns with NBCOT OTR practice standards for goal setting? Option A. Collaboratively explore the client's underlying motivations for this vocational goal, assess their current functional abilities in relation to the demands of the activity, and work together to establish modified, achievable goals that build towards their ultimate aspirations while prioritizing safety and functional progress. Option B. Focus exclusively on the client's physical limitations and prescribe exercises to address those deficits, without directly discussing or incorporating their vocational aspirations into the goal-setting process. Option C. Document the client's stated vocational goal as their primary objective, proceed with interventions aimed at that goal, and hope for the best, assuming the client will adapt or the goal will naturally become more feasible. Option D. Immediately inform the client that their stated vocational goal is unrealistic and unattainable given their current condition, and proceed to set simpler, more easily achievable goals without further discussion. The correct answer is A. Collaboratively explore the client's underlying motivations for this vocational goal, assess their current functional abilities in relation to the demands of the activity, and work together to establish modified, achievable goals that build towards their ultimate aspirations, while prioritizing safety and functional progress. Explanation. This scenario presents a professional challenge because it requires balancing the client's immediate desires with the occupational therapist's ethical and regulatory obligations to ensure client safety and promote meaningful, achievable outcomes. The occupational therapist must navigate the client's autonomy while upholding professional standards for goal setting, which are implicitly guided by NBCOT OTR practice standards, emphasizing client-centered care, evidence-based practice, and ethical conduct. The correct approach represents best professional practice because it prioritizes a collaborative, client-centered process that integrates the client's values and aspirations with the therapist's clinical expertise and understanding of functional limitations. This aligns with NBCOT OTR guidelines that stress the importance of shared decision-making and the establishment of SMART, specific, measurable, achievable, relevant, time-bound goals. By exploring the underlying reasons for the client's stated goal and collaboratively redefining it to be functional and attainable within the client's current capabilities and environment, the therapist upholds the principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. This approach also respects client autonomy by empowering them in the goal-setting process while ensuring the goals are therapeutically sound. An incorrect approach that focuses solely on the client's stated desire without clinical assessment or modification fails to meet the professional standard of care. It risks setting the client up for failure, potentially leading to frustration, decreased motivation, and a lack of progress, which could be construed as a failure to provide competent and ethical care as expected under NBCOT OTR standards. This approach neglects the therapist's responsibility to apply clinical reasoning and evidence-based practice to ensure goals are realistic and contribute to functional improvement. Another incorrect approach that dismisses the client's goal outright without exploration or collaborative adjustment disrespects client autonomy and can damage the therapeutic relationship. This can be seen as paternalistic and may violate the ethical principle of respecting the client's right to self-determination. While the therapist has a duty to ensure safety and efficacy, this must be achieved through communication and collaboration, not unilateral decision-making. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and acknowledge the client's stated goal, validating their perspective. Second, conduct a thorough occupational therapy assessment to understand the client's current functional abilities, limitations, environmental factors, and underlying motivations. Third, engage in collaborative discussion with the client, explaining the rationale behind any proposed modifications to the goal, linking it to their desired outcomes and functional improvements. Fourth, jointly establish SMART goals that are meaningful to the client, achievable within their capabilities, and aligned with therapeutic objectives, ensuring ongoing client involvement and agreement. Question 15. The risk matrix shows a moderate risk of skin breakdown associated with a client's preferred leisure activity of gardening. The client expresses a strong desire to continue gardening for its significant psychological benefits. What is the most appropriate intervention implementation approach? Option A. Proceed with the gardening activity as the client desires, assuming the psychological benefits outweigh the moderate risk, without further discussion or modification. Option B. Collaborate with the client to explore adaptive gardening tools and techniques that mitigate the risk of skin breakdown, educate the client on proper skin care and monitoring, and obtain informed consent for continued participation with these modifications. Option C. Document the moderate risk and the client's desire to garden, but postpone any decision-making until a physician can provide a definitive clearance for the activity. Option D. Immediately discontinue gardening as a therapeutic activity due to the identified moderate risk, and redirect the client to alternative leisure pursuits that pose no risk. The correct answer is B. Collaborate with the client to explore adaptive gardening tools and techniques that mitigate the risk of skin breakdown, educate the client on proper skin care and monitoring, and obtain informed consent for continued participation with these modifications. Explanation. This scenario presents a professional challenge because it requires the occupational therapist to balance the client's expressed preferences with the identified risks and the therapist's professional judgment regarding the client's safety and ability to benefit from the intervention. The risk matrix, a tool for assessing potential harm, highlights a moderate risk associated with a specific intervention. The client's strong desire to engage in this activity, despite the identified risks, creates an ethical dilemma. The occupational therapist must navigate the principles of client-centered care, beneficence, non-maleficence, and autonomy, all within the framework of NBCOT OTR regulations and ethical standards. The correct approach represents best professional practice because it prioritizes a collaborative and informed decision-making process. This involves thoroughly educating the client about the risks and benefits of the intervention, exploring alternative interventions that may achieve similar goals with lower risk, and documenting the client's informed consent or refusal. This aligns with NBCOT Code of Conduct, which emphasizes the therapist's responsibility to provide competent services, respect client autonomy, and act in the client's best interest while minimizing harm. The process of shared decision-making ensures the client's values and preferences are considered, while the therapist fulfills their duty to inform and protect. An incorrect approach that involves proceeding with the intervention without fully addressing the identified risks or ensuring the client's comprehension of those risks would be a failure to uphold the principle of non-maleficence and potentially violate NBCOT standards regarding informed consent and client safety. This could lead to harm to the client and professional repercussions. Another incorrect approach, such as unilaterally deciding against the intervention solely based on the risk matrix without engaging the client in a discussion about their goals and preferences, would be a failure to respect client autonomy and could be seen as paternalistic, undermining the client-centered nature of occupational therapy practice. This disregards the client's right to make choices about their own care, even if those choices involve perceived risks. Professionals should use a decision-making framework that begins with identifying the ethical dilemma and relevant principles. This is followed by gathering information about the client, the intervention, and the risks. Next, the therapist should explore potential courses of action, weighing the ethical implications of each. Crucially, open communication and collaboration with the client are paramount. Finally, the chosen course of action should be implemented and documented, with ongoing reassessment of the situation. Question 16. Benchmark analysis indicates that occupational therapists often encounter client resistance to specific intervention techniques. An occupational therapist is working with a client who has been prescribed a specific upper extremity exercise protocol to improve range of motion and strength following a stroke. The client expresses significant discomfort and a strong preference against performing one particular exercise, stating it feels wrong and painful, despite the therapist's reassurances that it is a standard and beneficial exercise. What is the most appropriate technique for effective intervention delivery in this situation, adhering to NBCOT OTR standards? Option A. Reiterate the importance of the exercise for their recovery, emphasizing the therapist's professional expertise and the evidence supporting the protocol, and encourage the client to push through the discomfort for optimal results. Option B. Immediately discontinue the problematic exercise and replace it with a completely different, less challenging activity that the client finds more agreeable, without further investigation into the client's specific concerns or the functional impact of the change. Option C. Engage in a detailed discussion with the client to understand the specific nature of their discomfort and perceived wrongness. Explore their underlying concerns, and collaboratively modify the exercise or explore alternative interventions that target similar functional goals while respecting their preferences. Option D. Proceed with the prescribed exercise as planned, explaining to the client that adherence to the protocol is essential for recovery, and that their discomfort is a temporary and expected part of the rehabilitation process. The correct answer is C. Engage in a detailed discussion with the client to understand the specific nature of their discomfort and perceived wrongness. Explore their underlying concerns, and collaboratively modify the exercise or explore alternative interventions that target similar functional goals while respecting their preferences. Explanation. This scenario presents a professional challenge because the occupational therapist must balance the client's stated preferences with the therapist's professional judgment regarding the most effective intervention for achieving functional goals, all while adhering to NBCOT OTR practice standards. The client's resistance to a potentially beneficial intervention requires careful consideration of client-centered care, therapeutic rapport, and the ethical obligation to provide competent and evidence-based services. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered strategy by first exploring the client's reasons for resistance and then adapting the intervention to incorporate their preferences or finding alternative, equally effective methods. The therapist upholds the principles of autonomy and respect for the client's values. This aligns with NBCOT emphasis on client engagement and the ethical imperative to provide services that are responsive to individual needs and preferences, as outlined in ethical codes that promote client participation in goal setting and intervention planning. An incorrect approach that involves unilaterally proceeding with the therapist's preferred intervention without addressing the client's concerns fails to respect client autonomy and may damage the therapeutic relationship, potentially leading to non-adherence and poorer outcomes. This violates ethical principles of informed consent and client participation in decision-making. Another incorrect approach, such as abandoning the intervention altogether without exploring alternatives or understanding the root of the resistance, could be considered a failure to provide competent and evidence-based care, potentially falling short of the professional obligation to facilitate client progress. A third incorrect approach, focusing solely on the therapist's expertise without acknowledging the client's lived experience and preferences, can lead to a paternalistic practice model, which is contrary to modern occupational therapy principles. Professional decision-making in such situations requires a systematic process. First, actively listen and inquire about the client's concerns and reasons for resistance. Second, educate the client about the rationale and benefits of the proposed intervention, addressing any misconceptions. Third, collaboratively problem-solve to modify the intervention to align with client preferences or explore alternative interventions that achieve similar functional outcomes. Finally, document the client's concerns, the therapist's rationale, and the agreed-upon plan. Question 17. Implementation of an occupational therapy intervention plan for a 4-year-old child diagnosed with a global developmental delay requires careful consideration of the family's cultural background and preferences. The child's parents, who are recent immigrants, express a strong preference for interventions that are integrated into daily routines and involve traditional family activities, rather than highly structured clinic-based sessions. They are also hesitant about certain types of sensory-based intervention they perceive as potentially disruptive to the child's spiritual practices. As the occupational therapist, which approach best aligns with the NBCOT OTR regulatory framework and ethical guidelines for providing services to children with developmental delays. Option A. Develop an intervention plan that prioritizes evidence-based, clinic-based therapeutic activities, explaining to the parents that these are the most effective methods for addressing developmental delays, and gently encouraging them to adapt their routines to accommodate these sessions. Option B. Collaborate with the parents to identify family-centered goals and select interventions that can be naturally embedded within their existing cultural practices and daily routines, adapting or modifying traditional therapeutic techniques to be culturally congruent and respectful of their spiritual beliefs. Option C. Proceed with a standardized sensory integration protocol that has demonstrated efficacy in research, assuming that the parents will eventually understand and accept its benefits, and address their concerns about spiritual practices by scheduling sessions outside of their designated prayer times. Option D. Focus solely on gross motor skill development through structured play in the clinic, as this is a primary area of delay, and inform the parents that other areas and cultural considerations will be addressed in future, more advanced stages of therapy. The correct answer is A. Develop an intervention plan that prioritizes evidence-based, clinic-based therapeutic activities, explaining to the parents that these are the most effective methods for addressing developmental delays, and gently encouraging them to adapt their routines to accommodate these sessions. Explanation. This scenario presents a common challenge for occupational therapists working with children with developmental delays, balancing the need for evidence-based interventions with the family's cultural values and preferences. The professional challenge lies in ensuring that interventions are not only effective in addressing the child's delays, but also culturally sensitive and respectful, fostering genuine collaboration with the family. This requires careful judgment to avoid imposing a single therapeutic model without considering the broader context of the child's life. The correct approach represents best professional practice because it prioritizes a client-centered and family-centered model of care, which is a cornerstone of occupational therapy ethics and aligns with NBCOT emphasis on ethical practice and client advocacy. Specifically, it adheres to the principle of informed consent and shared decision-making by actively involving the family in goal setting and intervention selection. This approach respects the family's autonomy and their right to make decisions about their child's care, ensuring that interventions are integrated into the family's daily routines and cultural practices, thereby increasing the likelihood of success and generalization of skills. This aligns with the NBCOT practice standards, which emphasize the importance of considering the client's environment and cultural context in intervention planning. An incorrect approach that fails to involve the family in goal setting and intervention selection would represent a regulatory and ethical failure. This would violate the principle of client autonomy and could lead to interventions that are not aligned with the family's values or practical realities, potentially causing distress or resistance. Such an approach could be seen as paternalistic and not in accordance with the NBCOT Code of Conduct, which mandates respect for client rights and self-determination. Another incorrect approach that solely relies on a single, highly structured, and potentially culturally unfamiliar therapeutic modality without exploring alternatives or adapting it to the family's context would also be ethically problematic. This could lead to a failure to meet the client's needs effectively and could be perceived as a lack of cultural competence, a key ethical consideration for occupational therapists. The professional decision-making process for similar situations should begin with a thorough occupational profile that includes understanding the family's cultural background, beliefs, values, and priorities. This should be followed by a collaborative discussion about the child's strengths and challenges, leading to the co-creation of meaningful and achievable goals. Intervention options should then be presented, explaining the rationale, potential benefits, and limitations of each, and how they can be adapted to fit the family's context. Ongoing communication and flexibility are crucial to ensure the intervention plan remains relevant and effective throughout the therapeutic process. Question 18. The evaluation methodology shows a tendency to prioritize the administration of a single, widely recognized standardized assessment tool for motor skills, with minimal time allocated for client interviews regarding their daily routines or direct observation of their participation in meaningful activities within their home environment. Option A. This approach is appropriate because the primary focus of occupational therapy is on improving motor skills, and other aspects of occupational performance are secondary to this core function. Option B. This approach is insufficient as it neglects the holistic nature of occupational performance as defined by the Occupational Therapy Practice Framework, OTF, which requires consideration of client factors, performance skills, performance patterns, contexts, and activity demands, as well as the client's subjective experience and environmental influences. A comprehensive evaluation necessitates integrating multiple data sources, including client-reported information and observations of performance in relevant contexts, to ensure client-centered and occupation-based practice. Option C. This approach is acceptable because standardized assessments are the most objective measure of occupational performance, and client interviews can be subjective and prone to bias, making them less valuable in the evaluation process. Option D. This approach is ideal as it maximizes efficiency by focusing on a single, reliable measure, allowing for quicker initiation of interventions and demonstrating adherence to time-sensitive treatment protocols. The correct answer is B. This approach is insufficient as it neglects the holistic nature of occupational performance as defined by the Occupational Therapy Practice Framework, OTF, which requires consideration of client factors, performance skills, performance patterns, contexts, and activity demands, as well as the client's subjective experience and environmental influences. A comprehensive evaluation necessitates integrating multiple data sources, including client-reported information and observations of performance in relevant contexts, to ensure client-centered and occupation-based practice. Explanation. This scenario presents a professional challenge because the occupational therapist must balance the need for comprehensive client information with the practical limitations of time and resources, while adhering strictly to the NBCOT OTR regulatory framework and the Occupational Therapy Practice Framework, OTF. The OTF, as adopted by the NBCOT, emphasizes client-centered practice, occupation-based interventions, and the importance of a thorough evaluation to inform the plan of care. The challenge lies in selecting an evaluation approach that is both efficient and effective in capturing the client's occupational performance deficits and strengths within the context of their environment and personal factors, as outlined in the OTF. The correct approach represents best professional practice because it aligns with the core tenets of occupational therapy as defined by the OTF and NBCOT regulations. This approach prioritizes a holistic understanding of the client's occupational engagement by integrating multiple data sources, including standardized assessments, client interviews, and observation of performance in naturalistic settings. This comprehensive data collection ensures that the evaluation is client-centered, occupation-based, and addresses the client's goals and desired outcomes. It also allows for the identification of environmental barriers and supports, which are crucial for developing effective interventions. Adherence to the OTF domains of occupation, activities of daily living, instrumental activities of daily living, rest and sleep, education, work, play, leisure, social participation, and performance areas, performance skills, performance patterns, client factors, contexts, and activity demands, is paramount. An incorrect approach that relies solely on standardized assessments without considering the client's subjective experience or environmental context fails to meet the OTF emphasis on client-centeredness and occupation-based practice. This could lead to an incomplete understanding of the client's needs and potentially result in interventions that are not meaningful or effective. Ethically, this approach could be considered a failure to provide a thorough and individualized evaluation, potentially violating the NBCOT Code of Conduct's principles of competence and beneficence. Another incorrect approach that focuses exclusively on client self-report without objective observation or standardized measures risks overlooking critical performance deficits or misinterpreting the client's perceived abilities. This approach may not adequately capture the nuances of occupational performance and could lead to an inaccurate assessment of needs. Regulatory failure here would stem from not conducting a comprehensive evaluation as expected under NBCOT standards, potentially impacting the validity of the subsequent treatment plan. A third incorrect approach that prioritizes speed over thoroughness by using only a limited set of observations without a structured framework or client input is also professionally unacceptable. This approach risks missing crucial information about the client's occupational profile and may not adequately identify underlying performance deficits or environmental factors. This would be a failure to adhere to the principles of evidence-based practice and client-centered care, as mandated by the OTR and NBCOT. The professional decision-making process for similar situations should involve a systematic approach. First, understanding the client's stated goals and concerns. Second, identifying the most relevant domains and areas of occupation to assess based on the client's presentation. Third, selecting appropriate evaluation tools and methods that are both valid and reliable, and that align with the OTR. Fourth, integrating data from multiple sources to form a comprehensive occupational profile. And finally, using this profile to collaboratively develop a client-centered, occupation-based intervention plan. This process ensures that the evaluation is thorough, ethical, and compliant with NBCOT OTR requirements. Question 19. Benchmark analysis indicates that a client with a recent stroke presents with significant upper extremity weakness and difficulty with fine motor tasks. The occupational therapist is considering various intervention strategies. Which approach best aligns with current NBCOT OTR standards for evidence-based practice in this scenario? Option A. Implementing a combination of task-specific training for functional activities and neuromuscular electrical stimulation, as supported by recent systematic reviews and meta-analyses for stroke rehabilitation. Option B. Focusing exclusively on the client's expressed interest in learning to play a musical instrument, without a formal assessment of other evidence-based interventions for motor recovery. Option C. Primarily utilizing traditional passive range of motion exercises and basic strengthening activities that the therapist has found effective in past clinical experiences. Option D. Selecting interventions based on the availability of equipment in the clinic and the therapist's personal familiarity with those specific techniques, regardless of recent research findings. Correct answer is A. Implementing a combination of task-specific training for functional activities and neuromuscular electrical stimulation, as supported by recent systematic reviews and meta-analyses for stroke rehabilitation. Explanation. This scenario presents a professional challenge because it requires the occupational therapist to balance the client's preferences with the most effective, evidence-based interventions, while adhering to NBCOT OTR standards. The therapist must critically evaluate available research and integrate it into practice to ensure optimal client outcomes. The correct approach represents best professional practice because it prioritizes interventions supported by robust research, aligning with the NBCOT OTR's emphasis on evidence-based practice. This ensures that the client receives care that has demonstrated efficacy, promoting functional independence and well-being. This approach also upholds ethical principles of beneficence and non-maleficence by utilizing interventions most likely to yield positive results and minimize potential harm. An incorrect approach that relies solely on anecdotal evidence or personal experience fails to meet the standards of evidence-based practice. This can lead to the use of interventions that are not effective, potentially wasting client resources and time and delaying progress. Ethically, this could be considered a failure to provide competent care, as it deviates from established best practices. Another incorrect approach that focuses only on the client's stated preference without considering evidence-based efficacy overlooks the therapist's professional responsibility to guide the client towards the most beneficial interventions. While client-centered care is crucial, it must be informed by professional expertise and evidence. Failing to do so could result in the implementation of interventions that are not aligned with best practices, potentially leading to suboptimal outcomes. This could be viewed as a failure to exercise professional judgment and advocate for the most effective treatment path. A further incorrect approach that prioritizes interventions that are readily available or familiar to the therapist, without a thorough review of current evidence, also falls short. This can lead to a stagnation of practice and the continued use of interventions that may have been superseded by more effective, evidence-based methods. This demonstrates a lack of commitment to ongoing professional development and a failure to provide the highest standard of care. The professional reasoning process should involve a systematic evaluation of the client's needs, a comprehensive search for current evidence related to those needs, critical appraisal of the research, integration of the evidence with clinical expertise and client values, and ongoing evaluation of the intervention's effectiveness. Question 20. System analysis indicates that during a session focused on improving a client's upper extremity strength for dressing, the client comments, "You seem a bit tired today. Did you have a busy weekend?" The occupational therapist is aware that their personal weekend activities are not relevant to the client's treatment plan and could potentially lead to an inappropriate shift in the therapeutic dynamic. Considering the NBCOT OTR regulatory framework, which of the following responses best exemplifies the therapeutic use of self while maintaining professional boundaries? Option A. Ignore the client's comment entirely and proceed with the planned therapeutic exercises as if the observation was not made. Option B. Respond defensively, stating that personal matters are not relevant to therapy and that the client should focus on their exercises. Option C. Briefly acknowledge the observation without elaborating on personal details, then gently steer the conversation back to the therapeutic activity and the client's goals. Option D. Share detailed anecdotes about the therapist's weekend, including specific challenges and activities, to build rapport and demonstrate relatability. The correct answer is C. Briefly acknowledge the observation without elaborating on personal details, then gently steer the conversation back to the therapeutic activity and the client's goals. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the occupational therapist to navigate a complex interpersonal dynamic while maintaining professional boundaries and ensuring the client's therapeutic goals are met. The client's perception of the therapist's personal life can significantly impact the therapeutic alliance, potentially leading to transference or countertransference issues that could derail treatment. The therapist must demonstrate a high level of self-awareness and emotional regulation to manage their own reactions and maintain objectivity. Correct approach analysis. The correct approach, which involves acknowledging the client's observation without oversharing personal details and redirecting the conversation back to the therapeutic goals, represents best professional practice. This aligns with NBCOT OTR practice standards, emphasizing the importance of maintaining professional boundaries and ensuring that the therapeutic relationship is client-centered. By validating the client's observation while gently re-establishing the professional context, the therapist upholds the integrity of the therapeutic process and prioritizes the client's occupational performance and well-being. This approach demonstrates the therapeutic use of self by leveraging the therapist's awareness of the client's perception to strengthen the therapeutic alliance, rather than allowing it to become a distraction or impediment. Incorrect approach is analysis. Sharing extensive personal details about the therapist's weekend activities would be a regulatory and ethical failure. This blurs professional boundaries, potentially leading to an inappropriate level of intimacy that is not conducive to achieving therapeutic outcomes. It shifts the focus from the client's needs to the therapist's personal life, violating the principle of client-centered care and potentially exploiting the therapeutic relationship. Such a breach could be considered unprofessional conduct under NBCOT guidelines. Becoming defensive or dismissive of the client's observation is also professionally unacceptable. This reaction can damage the therapeutic alliance by making the client feel unheard or invalidated. It demonstrates a lack of self-awareness and emotional regulation on the therapist's part, hindering their ability to effectively use themselves as a therapeutic tool. This could be interpreted as a failure to establish and maintain a trusting therapeutic relationship, a core tenet of occupational therapy practice. Ignoring the client's comment and continuing with the planned activity without any acknowledgement could also be problematic. While it avoids oversharing, it misses an opportunity to address a potential dynamic that might be influencing the client's engagement or perception of the therapy. A complete lack of acknowledgement might leave the client feeling disconnected or misunderstood, potentially impacting their willingness to participate fully in therapy. This represents a missed opportunity to utilize the therapeutic use of self to enhance the therapeutic relationship. Professional reasoning. Professionals should employ a decision-making process that prioritizes client well-being and adherence to ethical and regulatory standards. This involves 1. Recognizing and acknowledging the client's statement and its potential impact on the therapeutic relationship. 2. Assessing the situation for potential boundary crossings or ethical concerns. 3. Responding in a manner that maintains professional boundaries, validates the client's experience without oversharing, and redirects the focus to therapeutic goals. 4. Reflecting on the interaction to identify any personal reactions or biases that may have influenced the response and to inform future practice. This systematic approach ensures that the therapist's actions are always in service of the client's occupational goals and the integrity of the therapeutic process.